post lunch, all of you are here. Thank you for coming for this session.
This is a sort of an alumni of AP and Telangana.
So coming to the evolution of intraocular lenses, all of us have gone through monofocal lenses, then multifocal lenses, and now extended depth of focus lenses are the flavor of the season. And they have some advantages and disadvantages. From the patient's perspective, an ideal lens is which gives near, intermediate and distance without any dysphotopsia or decrease in contrast sensitivity. That's the natural lens below 40 years of age. That's what a patient wants. But the present day technology is still evolving and we don't have an ideal lens. So recently, a few years back, we had these eye-enhanced lenses from J&J, which were better than the monofocal lenses. They were giving some intermediate vision because they have tweaked the asphericity and then gave some extension of the intermediate vision. Then VVT lens had come 2-3 years back by Alcon, which had a bump and which were giving a little bit more of the intermediate and near vision. So we were using both and we just wanted to know what is the benefit, because the cost of the lenses were 4 times more of VVT lenses compared to J&J lenses. So just to give a simplified overview of our results, we compared the uncorrected distance and near visual acuity post-operatively at 4 weeks of 100 recipients of each of these lenses. So it's not hi-fi research like contrast sensitivity and all those things, but just basically from the clinical perspective, we compared eye-enhanced lenses and VVT and VVT toric lenses, 100 each from each consecutive series, and we found that unaided distance vision was 6/6 in 43% of eye-enhanced and 58% of VVT lenses, and with the other commensurate of visual acuity. The target refraction for eye-enhanced was somewhere between 0 to 0.5, because we wanted a little more on the negative side rather than the positive side, whereas for VVT it was aimed at distance for 0 power, because that way the company recommends that there will be adequate distance and near vision. Near vision, which the patient usually feels that that's a success of the surgery. So eye-enhanced lenses gave us N6 vision in 18% of patients, whereas VVT and VVT toric gave 46%. So there's definitely 50% of the patients with VVT lenses were having very comfortable with distance, intermediate and near. So that's the advantage compared to eye-enhanced lenses. And there was no significant glare or halos in either of these lenses, because a significant number of patients who drive at night, we've implanted VVT lenses and they were very happy with those lenses and nobody really complained. But the downside is eye-enhanced lenses are nearly 4 times less expensive than VVT lenses. So we need to advise these lenses for relatively well-off patients. And both groups were counseled that they have to wear glasses for near, because not to make them over-expectant. So to conclude, VVT and VVT toric lenses had greater spectacle independence. About 46% had N6 vision compared to eye-enhanced lenses, which was about 18%. Thank you very much for your attention.
Thank you, Dr. Madhukar. Very interesting, and it is intriguing to see that a good number of your eye-enhanced patients had N6.
Yes.
Yeah, so that's, even though it's not traditionally an extended depth of focus lens, it's more of an enhanced monofocal. But some of these patients do get pretty good near vision, and at 40 centimeters they can actually see N6. I think one needs to qualify at what distance you're seeing N6.
N6.
Yes,
so
whether it's 33 or 40, sometimes at 33 they may not see, but they may see it at 40.
Yeah.
So, but it's interesting times actually, and increasingly we are finding ourselves moving more towards these lenses rather than bifocals and trifocals, because of the better optics, and they also in evolution. The EDOFs also are in so many different optic mechanisms are there for different EDOF lenses. So I think we'll have to see which one stands the test of time and which ones we eventually end up using. Recently, new one has been launched from J&J, and then their Lentis M Plus has a one lens called Femtis, which is specifically made for a femtocataract, in which the lens clips onto the capsular axis and it's got varifocal optics. So a lot of new lenses coming in, and very interesting times.
And also these are more forgiving if there's any other EDOF lenses compared to multifocal lens are more forgiving
Yeah.
if there's any minor corneal opacity or macular problems.
I also noticed in your series you said you didn't have any patients with any visual complaints, but I did have a couple of my VVT patients who were unhappy with the quality of vision, and I couldn't think of any other reason but the
I'll
actual
get there
optic.
soon.
Yeah. So any questions from the audience? Come into the mic.
Yeah.
Recording or in
So
we have
recently
time for
iHands
this.
is giving more of N8. That's my experience. Even
Yeah.
after repeating I'm not sure whether they have.
Some will get
Change the
N6,
bump.
some will get N10, some will get N18 also. It's
Yeah,
very
but-
variable. That's the whole problem. It's unpredictable.
But the multifocal lenses I find are having much lesser glare and halos. So unless there's a straightforward contraindication like diabetics or some glaucoma,
But multifocal lenses nowadays everybody drives at night. Most of the people.
but they're not giving.
They
I'm
get
not sure what your
adapted to it.
experience is. Yeah.
Yeah, but in case whatever is the traditional thing, if something goes wrong, a lot of nowadays medical tourism is also there. US patients come and they have to drive at night, otherwise they're disabled. So one patient is enough to.
Yeah.
And
I'll tell you one thing, Charita, my experience. One of my patients, she doesn't drive at night. I specifically asked her. Her sister had a trifocal lens because she was just not suitable for anything else, and she had a clear lens, but she just didn't want to wear glasses. So we went ahead and did a clear lens exchange with trifocal. Very happy. Seeing her sister came to me, who was a fashion designer. Now I put a trifocal lens, Plano 66N6, but extremely unhappy. Why? Because in her studio where she does the designing, she has LED lights. LED lights are everywhere, and those can also give halos. So you don't know which patient will be unhappy. That's the problem with these lenses.
I've seen one patient with multifocal put 10 years ago. Diabetic and retinopathy has developed now.
Yeah, that's what I want to enhance. That multifocals please differ in patients with retinal conditions. In future, it becomes very tough for us to manage the retinal
Yeah,
conditions.
how about
with
EDOF
multifocal.
lenses? VVT lenses, is it good for
Yeah,
doing
yeah.
laser?
Yeah, yeah.
Better than
Better than
multifocals?
Yeah. Okay. With this, we will go to the next.
I'm Dr. Rahul Shukla. I am from Jabalpur, Madhya Pradesh. Next is the MPSOS session, so I've come here a bit early. So there was a study which was done by Dr. Mayank Nanavati, the EACRS study, wherein a monofocal IOL is also giving N6 vision in around 8 to 9% of the patients. So if your IQ or your techness gives you an N6, don't feel surprised and don't feel that you have done something extraordinary. There are 9% of the patient who would give you an N6 vision. Right? Yeah, definitely iHands is something which is a more forgiving lens. And if you explain it to the patient, I think it becomes much easier for you. It puts less burden on the budget. The pocket is really safe. Yes, EDOF is a better way. I mean, VVT is obviously much better. There's no doubt about it. Just wanted to highlight this fact.